Welcome back to the Joy in Our Town program. My name is Joseph Mass. I'm the host for today. And again, we are just glad to have you viewing with us. And we are just excited to have visiting with us in the studio today Dr. Beaumont and Dr. Henry, both from Mobile Chiropractic Associates. Again, welcome to the broadcast.
Thank you.
Now we in this segment, and that first segment just went way too quick, but in this segment we want to turn our attention, we've looked at chiropractic. What is it? Who can benefit from it? It's an alternative to just medications being thrown at you that you treat. Actually, can we do this? Can you give us an understanding of who would come to you? When we there are 3-year-olds that know, mommy has passed out and they know to call 911. So we know when to go to the doctor for the most part. This pain just won't go away or what have you. When do we come to see a chiropractor? And I know, based on what you're saying, it's more than just my back hurts. So can you expound on that? And then we're going to start looking at nutrition in this segment.
Well, a lot of people, first, they may go to a medical doctor. They may go to the emergency room and then still hurt. And that's where they start talking to their friend. And that's usually where they get a suggestion to see a chiropractor.
Okay.
Some other family member have benefited from that. And some other ones, they just happen to know chiropractic can help at least back problems. That's basically their knowledge of it.
Right.
And they'll look in the yellow pages or a directory service or the internet. I mean, now the internet is a great place to go. So it's usually a word of mouth and people that know what happened and where it would be the benefit. That's usually what we have. We don't have the benefit of having program on TV to really make it look like what we all do in there, and people would know right away, oh, I got to go there.
Right, right.
Well, I think sometimes too, what I do, a lot of nutritional testing, is that people hear about nutrition. They're kind of being bombarded right now. This helps this and this helps that, so they're sort of waking up to the fact that, gee, maybe, one of them came in, maybe this could help my mother, and one of them came in recently and said, gee, do you still do that nutritional testing? Which I've developed over like 20 years. Yes, I do, and they bring them in various, all kinds of different conditions, alternative, because they just aren't getting the answers, and things they're not getting better, So,
and we're going to look at nutrition, and would it be accurate to say nutrition is probably, how would I say it, in terms of whatever you're dealing with, whether it's cancer, whether it's MS, whatever it is, nutrition would be a vital dynamic in the overall treatment of conditions such as that. So that even for someone with cancer, they could find benefit from coming to a chiropractor. Is that accurate?
That's accurate.
Okay.
I mean, what you're looking for is a way to find, what I've developed is a way to find the particular needs of that patient. Okay. It doesn't have anything to do necessarily with, quote, a condition, but you're asking the body, what are the needs, so the body can help fix itself. That's what nutrition can do. So it doesn't matter what the diagnosis is, perhaps. It's the dynamics of that body choosing what it needs to help survive. And our testing is based on the body wants to survive, and it will choose things. Now, when you use herbs and clinical nutrients like we do, is that the right term? Clinical nutrients, maybe? Yeah, that would be when you're using those, 70% of drugs came from herbs. Okay. They were spun down, they were concentrated, and they were given to people. Well, that's when they started having drug reactions, and then they started putting them together in the laboratory, a bunch of chemicals. Drug reactions were even worse. So what we're trying to do is give them something that they're not going to have side effects, they're going to have benefits, it's going to protect the body, it's going to help build the body up, and hopefully solve their health problems.
And it is,
or at least be a big help, if not, we're not looking at a cure necessarily, but we're looking at what a quality of life for that patient.
Isn't it true that chiropractic, part of the philosophy is to tap into the body's own ability to heal itself?
Absolutely.
And to develop the immune system and the other systems in the body to give it the best fighting chance
The best support
Yes.
possible.
Yeah.
that it has.
Yeah.
So in that sense then, whatever you're dealing with, whether it's cancer, MS, whatever, as I said before, this would be a foundation that would be tremendously beneficial.
Yeah.
to you.
Even if medication is successful at maybe abating the symptom, it still doesn't do anything to regenerate tissue.
Right.
Only nutrition will, only the component of
That's-
minerals,
that's awesome.
vitamins, proteins, whatever you need the body to rebuild those tissue. If they're dying, something has to rebuild them.
Right.
So that's what it is. Now, sometimes it's a combination of both.
Of
I mean,
both.
and in an advanced case,
Yes.
you have to work both ways with the medication and the nutrition, but you can't